Good evening. My name is Ceol, and I'm a professor at the University of Massachusetts, and my lab were one of the recipients of this year's Established Investigator Awards from the MRF. So for many years, we've been interested in identifying new vulnerabilities in melanoma with the idea that we can ultimately target these vulnerabilities therapeutically. And this is important because, as you know, immunotherapies have made a massive difference for patient outcomes. However, about half of all melanoma patients who receive these therapies develop resistance. And so we've identified a vulnerability that has to do with how melanoma cells subvert normal processes. And so the normal process in this case is melanocyte development. So during melanocyte development in embryos, you have a pool of pre-melanocytes that can divide a lot, they can migrate to every different site in the body, but once they get there, they differentiate into fully fledged melanocytes that can no longer divide and they can no longer migrate. In melanomas, they have instituted a block that prevents this from happening. So it keeps melanoma cells in a state where they can divide rapidly to support tumor growth, and they can migrate to support metastasis. So we've developed a therapy that relieves this block. And when we apply this therapy, melanoma cells make this transition. So they start to differentiate, and ultimately what happens is that they die. And so this therapy we think is important for a few different reasons. The first of which is it's a cytotoxic therapy, so it will kill tumor cells and shrink tumors. The second of which is that this block is evident in about 75% of all patient melanomas. So this therapy has the potential to affect many different melanoma patients. In addition, it's a therapy that's not just on paper. We've taken it quite far. So it's an antibody-based therapy. We've shown that it can work in tissue culture, that it works in preclinical models, and we've made humanized versions of these antibodies that we're getting ready for clinical testing. So we're pretty close. And the last thing is that it is a therapy that works in a different way than immunotherapies. And so it has the potential to work in conjunction with them. And that's the work that the Melanoma Research Foundation is funding. So what we're going to do is to test whether our therapy can kill tumors that are already resistant to immunotherapies, and whether it can work in conjunction with immunotherapies to prevent resistance in the first place. So with that, I'd like to close by saying thanks to all of you for your generosity in supporting the Melanoma Research Foundation and supporting the innovative research that is funded by the MRF. It's made a huge difference so far to the lives of melanoma patients, and our hope is that we can contribute to that in the future. Thank you.